All right, so just continuing here in chapter 14, now talking about some of the common conditions that can occur during pregnancy, like morning sickness, and then moving on to breastfeeding and some conditions that can lead to birth defects. During pregnancy, heartburn is pretty common due to progesterone that relaxes those muscles and increases acid reflux into the esophagus, just due to those changes in hormones. So some remedies is just not lying down, which just allows, prevents gravity from kind of doing its jobs. So drinking lots of fluids between meals to keep it the stomach nice and full, decreasing that acid, lower fat diets, and avoiding spicy foods. Constipation and hemorrhoids are also common. So with constipation, it's due to just relaxing those intestinal muscles. The fetus is competing for space, so it just, kind of decreases room. That extra iron in the prenatal vitamins, that can cause constipation. So that regular exercise helps with that, in consuming plenty of fluids and fiber in the diet. Now, the hemorrhoids are caused by straining during elimination resulting from that constipation. So if you can avoid or alleviate the constipation, then that helps indirectly with the hemorrhoids. Swelling or edema, also very common. Those placental hormones cause the retention of fluids that increases the blood volume. So some swelling is normal, but restricting salt and other diuretics are not needed for mild edema. So it's only a problem if it's accompanied by the hypertension or protein in the urine. And these are constantly checked at all of the checkups leading up to pregnancy. Nausea and vomiting, so morning sickness, very common, especially 70 to 85% experience it during that first trimester. Typically gets better, but not always. So avoiding nauseating foods, and that changes during pregnancy. Some smells you may have liked are now horrible. Saltine crackers or dry cereals. Avoid drinking lots of fluids, so intermittent, smaller quantities are better. Same thing with the meals. So instead of eating large meals, small, frequent meals are better to help alleviate that. Anemia, or that lack of iron. So again, normal increase in blood volume kind of dilutes out those red blood cells, and that can result in the anemia. Just in that increased blood volume, again, dilutes those out. Because the mom's blood volume increases about 150. Again, that was part of the weight that's added during pregnancy, about 4 pounds. And the red blood cells increase by 20 to 30%. So there's a lower ratio, so the red blood cells don't increase as much as the blood volume. So now that can lead to that anemia. And it occurs as that normal response during pregnancy due to that change. Gestational diabetes. In this case, again, of course, diabetes we talked about with glucose levels not being regulated. Gestational is when that wasn't an issue before, likely won't be an issue after, but during pregnancy, those sugar levels fluctuate. And this is because the hormones made by the placenta decrease the efficiency. So insulin's being made, cells just aren't responding to it. And this actually develops in about 10% of pregnancy. So there's a routine screening about 24 to 28 weeks that will test for gestational diabetes with a glucose test. And then if gestational diabetes is detected, then that diabetic diet may be in place. And insulin may need to be added in some cases, though that's less common than is not very common in those with gestational diabetes. Now, what are the results? This usually leads to a higher birth weight for the infant. Low blood glucose can cause trauma and malformations in the fetus. It usually disappears after birth, but is linked to developing diabetes later on. Hypertensive disorder in pregnancy. So gestational hypertension or high blood pressure. Again, didn't have high blood pressure before, but this is whenever there's high blood pressure after 20 weeks. It resolves at the end of pregnancy, and it's actually decreased if there's enough calcium and vitamin D that's coming into the diet. And then just a couple terms that are often related to this: preeclampsia. This is a mild form of that gestational hypertension. Protein in the urine, so that's why urine samples are collected at all of the different many of the different appointments before delivery, is looking for protein in the urine, which is an indicator of gestational hypertension. So the amount of that determines the mild form, preeclampsia, or eclampsia, which leads to a higher amount of protein in the urine and even can cause seizures. This is one reason for putting individuals on bed rest, trying to decrease that hypertension or alleviating stress, or anything else that may lead to high blood pressure. Some of the early symptoms of that, again, obviously blood pressure going up, the protein in the urine we just mentioned, but also swelling or that edema, changes in blood clotting, headaches, and visual disturbances. Now, severe effects are those seizures that can occur in the second and third trimesters, and ultimately, worst case scenario, liver and kidney damage that can lead to death. All right, now switching over to breastfeeding. So again, now that fertility has occurred or fertilization, baby has been born, now talking about nutritional needs right after that. So breastfeeding, according to the dietary guidelines, breastfeeding is preferred exclusively for the first 6 months of life. So a combination of breastfeeding and infant foods until 1 year is then recommended. So exclusively breastfeeding for 6 months, then introducing foods, but continuing breastfeeding up to a year. Now, the World Health Organization actually recommends breastfeeding for at least 2 years, with solid foods being increasingly added. Now, just looking at kind of some numbers, again, this is not a test question, but just kind of interesting numbers. So the incidence of breastfeeding, about 80% of all mothers begin breastfeeding in the hospital. 50% continue for the 6 months. Only 25% though exclusively breastfeeding, meaning no formula being supplemented or added, and only about 30% or a third are still breastfeeding after the year, but also again including other solid foods. So just looking at planning on breastfeeding, so almost all women are physically capable of doing it. However, some barriers, mainly lack of knowledge or support, especially if the grandma in this case, so the mom's mom, didn't breastfeed, then they're less likely to, or vice versa. If they were breastfed, they're more likely to breastfeed. Again, inexperienced moms, again, just kind of that lack of information, or especially younger moms. So refer to the lactation consultant though for advice on how to properly do it. It's important to monitor breastfed babies, looking for a risk of dehydration, so counting the number of diaper changes, having those, looking for normal weight gains, just as ensuring they're getting enough from the breast milk. As far as breast size and weight, again, those are increased by the 3rd or 4th day of breastfeeding, in which that milk, we'll talk about here, the letdown, where the full milk comes into the breast. Looking now at how milk is produced as human milk, the hormones involved. So those milk producing cells and lobules actually occur during pregnancy. The lobules are sac-like structures that store the milk. They're called alveoli, same term we use for the sac-like structures in our lungs that help with gas exchange. The hormones involved include prolactin, so lactin or lactose, that actually stimulates the production of milk, and the infant suckling stimulates the release of that hormone from the pituitary gland. And then also oxytocin, which is the same hormone that triggers delivery of the baby and starts that process, that allows those globules to contract and actually let down or release that stored milk. Our image here just showing this letdown reflex, which is actually a connection between the brain and the breast. Suckling, again, as we mentioned, stimulates the release of that prolactin that causes production of milk. So in response, that hypothalamus stimulates that pituitary to release oxytocin. So prolactin makes the milk. Oxytocin causes the contraction of the ducts that actually is going to let down or release the milk that has been stored. So again, prolactin makes the milk. Oxytocin allows it to come down. And that can be inhibited by being nervous, just low confidence, and that can delay or even prevent some women from going through with breastfeeding. Now, looking at the nutrients that are in human milk, so those proteins are made by the breast tissue, and they include antibodies and enzymes from the mother's blood that are in there. Also, the fats that come through the mother's diet and those made by the breast tissue. Carbohydrates are in there, so galactose is made by the breast tissue. Glucose comes from the mom. And then lactose is formed whenever those two combine. So that's what actually produces the lactose that's in it. So galactose made by the breast, glucose coming from the mom. Those two combine to form the disaccharide lactose. Now the nutritional qualities here are different than cow's milk. So unless altered, the cow's milk never should be used for infant feeding. So not until the infant is at least 12 years old. It is too high in minerals and protein and not enough carbs. The proteins that are in there are harder to digest, and it triggers a lot of different allergies. So the fore milk is the milk initially released. That resembles skim milk that has lower fat content. Then the hind milk that gets made, which is about 10 or 20 minutes into the feeding, that's more of the cream and that higher fat. So the longer that the infant is suckling, the more fat and the more nutrients that they're getting. So if they're doing kind of frequent start and stop, they're more just getting that fore milk, and it can actually cause some delays in weight gain because they're not getting to that kind of hind milk that has that additional fat. Also, there's what's called colostrum. This is kind of a thick yellowy fluid that's made late in pregnancy and just a few days after birth. So this is kind of pre-milk almost. So it's only made right after delivery. So it has a lot of antibodies and immune cells, some growth factors, and some milk carbohydrates or oligosaccharides. Those promote growth and beneficial bacteria to set up that gut microbiome and limits the potential toxic bacteria. And it also provides protection against infection. So this kind of pre-milk or this colostrum is really important for getting that to help with the immune system development. Now the mature milk, this is thinner and watery, almost has a little bluish tinge to it. These have easily digestible proteins that can bind to iron, reducing bacterial growth. The high linoleic acid, some of those omegas, and cholesterol content are in there that are needed to form our membranes and especially our brain development. Those long chain omega-3 fatty acids, those are in there and important for making, again, tissues of the nervous system, again, especially the brain and the eye. Supplementing or adding additional water or juice. So human milk is all that is needed for hydration. So there are no supplements needed to be added. Again, exclusively breast milk for that first 6 months, and then supplementing some foods from 6 months to a year. But again, only added after that 6 months, because too much water, again, just like that hyponatremia, It can cause brain disorders, and it dilutes the sodium that causes problems. So again, only should be added under a clinician's supervision. Now, human milk for preterm infants, so feeding that is linked to a lower infant mortality. So especially if it's preterm and they're in an incubator like we see here, the mom is encouraged to pump their milk, and then it is fed that way through it instead of using formula. So it helps decrease the risk of death, and again, decreases risk of infection that they're more prone to, reduces the stay in the neonatal intensive care so they can come home sooner, less likely to have to be readmitted, and they just have better growth and improved brain development. Again, formula fed, definitely they try to add in some of those, some probiotics or good bacteria into that. It's definitely formulated to mimic human milk as much as possible, but it's just not the same. So the benefits of breastfeeding are better unless they, just cannot be used. Also, again, this does, though, require that pumping as we see here, so it does take that maternal dedication. So again, that kind of uncoordinated suck and swallow reflex makes it really hard for especially a preemie to attach, and once they are able to nurse. So again, usually it's expressed and fed through the tube. And if that human milk is used to feed, the fortification of milk with certain nutrients is often needed to help with that. So again, lots of people help guide the decision about formula or breastfeeding during that, in those cases. Now we're going to switch to kind of an eating plan considerations. So most substances that are ingested are secreted into the mom's milk. So this means that for the first 6 months, again, an increase in calories is needed, about 330, and then additional calories are needed between the 6 and 12 months. And that's because the infant is consuming more, so more milk needs to be made. So it requires an additional 500 kilocalories per day. So actually, moms who are breastfeeding, it's a little easier for them to lose some of the weight because they're using those calories to make their milk. So again, it helps with that gradual weight loss. The post-pregnancy weight loss should be about 1 to 4 pounds per month. Again, it shouldn't be drastic, but there is an increased need for vitamins A, E, C, the riboflavin, copper, chromium, iodine, selenium, magnesium, and zinc after pregnancy. Again, some of the advantages here of breastfeeding, again, fewer infections due to those antibiotics, lower risk of non-communicable, so non-infectious diseases like obesity and diabetes, lower atopic diseases like asthma and eczema, especially if at least 3 to 4 months of breastfeeding occur, and it's just more convenient and cheaper than formula. Even more advantages to the infant. So breast milk has no bacteria in it to be contaminated. It's always fresh and ready to go. Again, those antibiotics help with the immune system. That healthy gut microbiota gets established from breast milk, decreased risk of infections. Again, those atopic diseases, decreased risk of celiac or IBS disease, establishes habits of eating in moderation that help decrease that type 2 diabetes and obesity, contributes to the development of the jaws and the teeth better because they have the sucking that's needed for breast milk is more than from a bottle, enhance nervous system development and therefore learning abilities, and just decrease risk of leukemia or lymphoma. Now, to the mom, there are benefits there as well. Again, early recovery from pregnancy. Those hormones promote quicker return of the uterus to its pre-pregnancy state. decreased risk of several chronic diseases later, like hypertension, cardiovascular, and diabetes, decreases the risk of cancer of ovarian and premenopausal breast cancer. There's a potential for delayed ovulation, so it reduces the chance of getting pregnant right after delivery. And it's also faster to return to that pre-pregnancy weight because of the calories being burned to make the milk. Now, some of the barriers, though, again, misinformation, having to return to work, which can either, especially if individuals have problems pumping, just being embarrassed or modest about breastfeeding. But there are some medical conditions that can prevent breastfeeding. So with the infant that has a condition called galactosemia, where they can't break down galactose, then there's no way to take that out of breast milk. So on the mom, who, if she has to take different medications and those could pass to the infant, then breastfeeding would have to end. Those with tuberculosis, AIDS, or in chemotherapy, those individuals, again, can't breastfeed because it could impact the baby. And then just cosmetic alteration. So for example, past surgeries that could impair the ability to breastfeed, or new nipple piercings or breast tattoos can also prevent breastfeeding. Some different ways to kind of prevent some environmental contaminants are consuming a variety of foods, not eating freshwater fish from polluted water, again, decreasing that mercury exposure, washing and peeling fruits and vegetables to decrease those pesticides, removing the fatty edges, so trimming the meat, again, decreasing those pesticides. Same things that we talked about before for keeping our food safe, even a little bit more important while breastfeeding because it can be more damaging to the infant when they cross over. Right, some dietary supplements for breastfed infants, according to the American Academy of Pediatricians, recommend some vitamin D supplements for those who are breastfed, iron supplements for those being breastfed at 4 months and earlier if they were preterm or had a low birth weight or the mom had an iron deficiency. Otherwise, it's not needed. Not having any fluoride before 6 months. And then for vegan moms who are breastfeeding, supplementing with vitamin B12. So some incidents and causes of different birth defects, about 1 in every 33 babies, just some stats here. Heart defects in 1 in every 200 or 100 to 200. Neural tube, 1 in 1,000. That's decreased though because of those folate supplements. Down syndromes, about 1 in 800 births. Some others include some musculoskeletal defects, some GI defects or metabolic disorders, and just some kind of genetic incidents, about 15 to 25. Environmental influences cause about 10%. And then honestly, the majority really are just unknown or can't be determined. Again, these are not test questions, it's kind of putting some stats to help you relate and understand the importance of our nutrition. Now, some of those birth defects can include spina bifida or other neural tube defects due to a lack of that folate during pregnancy where it doesn't close properly, and you get this kind of growth or bulge of that neural tissue. Also, congenital hypothyroidism. This is due to a deficiency in iodine. So for the first trimester, again, that critical period for brain development, so low iodine can lead to that hypothyroidism. This used to be called cretinism. And some of the consequences, intellectual disabilities, stunted growth, infertility, impaired hearing and speech, large tongue, as you can see in this picture, enlarged head, and puffy eyes. Antioxidants, so an abundance of free radicals results from damage to cells in their DNA. This can lead to different mutations and tissue malformations. So that's why it's important to consume proper vitamin nutrients that have those antioxidant properties like vitamin E, vitamin C, selenium, zinc, and copper. So again, as long as diet is normal or supplements are given, again, whole grains, legumes, fruits, and vegetables all help prevent mutations during gestation. Getting enough of that vitamin A or without consuming too much. So the teratogenic effect, which is something that causes birth defects, those are as low as about 3,000 micrograms a day, can lead to that toxicity, and that can cause facial and cardiac effects. So again, supplements, if they're being used, should not exceed that amount. So those excesses typically arise from dietary supplements more so than consuming too much of a food. So again, just watching those supplements during pregnancy to ensure they don't have too much vitamin A. Also, the effects of caffeine. So heavy caffeine during pregnancy, so more than about 5 cups of coffee or the equivalent, can decrease iron absorption. It decreases blood flow to the placenta, causes actually withdrawal symptoms for the newborn, and can increase miscarriages and low birth rates. So again, moderate caffeine if individuals can't just cut it out. So about 200 milligrams or just 1 cup have not been associated with birth defects. So again, it doesn't have to be completely eliminated. That's the safest option. But if it is consumed, again, about the equivalent of 1 cup or 12 fluid ounces. Aspartame, so this is phenylalanine that's part of artificial sweeteners, aspartame, that's found in equal. This is harmful for moms that have PKU, and it can also disrupt the fetal brain development. So some artificial sweeteners can be used during pregnancy, but aspartame is one that should be decreased. Again, some moderate use is okay as long as PKU isn't an issue. But again, eliminating it completely is the safest way, or using other artificial sweeteners. But again, those with aspartame, which are most diet sodas and that type of thing, again, too much can definitely cause some impacts. Obesity and chronic health conditions. So regular checkups before pregnancy are important. So health problems that increase that risk are in moms who are obese, that have high blood pressure or uncontrolled diabetes. That can cause obesity and chronic health conditions in the infant. Those that have seizure disorders and metabolic disorders can cause fetal development issues. And then women with diabetes are about 2 to 3 times more likely to give birth to a baby that has some type of birth defect. And then finally, alcohol. Of course, I said we would come back to this. Should be avoided during pregnancy because it can cause fetal alcohol syndrome or spectrum disorders. Kind of depends on the amount of alcohol. So chronic alcoholism during pregnancy leads to this. Children born with a variety of different problems. The most severe is the fetal alcohol syndrome. So there are other effects that don't quite reach that level. But the diagnosis is poor fetal and infant growth, physical deformities, especially in the face, and intellectual disabilities that are typically not evident till later on. It can include irritability, hyperactivity, shortened attention span like ADHD, limited hand-eye coordination as well. And then this is just showing some of the facial features that are prone to that fetal alcohol syndrome from consuming alcohol during pregnancy.